The Senate is seeking a nationwide mandate requiring hospitals to stock minimum quantities of antivenom and other life-saving antidotes following concerns over preventable deaths from snake bites and similar emergencies. Lawmakers say the move is aimed at closing critical gaps in emergency healthcare delivery, particularly in high-risk areas across the country. The resolution was triggered by a point of order raised by Senator Idiat Adebule, representing Lagos West, who drew attention to the tragic death of a young Nigerian, Ifunanya Nwagene, reportedly due to the unavailability of antivenom after a snake bite. Senator Adebule speaks on the need for compulsory antivenom availability and improved emergency response in hospitals.
Stink, poison, drug overdose, another form of envenomation, all of which require the immediate administration of specific antidotes and emergency medicines in both public and private school hospitals in order to prevent avoidable death and irreversible health complications. Further note that with grave concern, the tragic and avoidable death of Mrs. Ifunanya Nwagene, who reportedly died following a snake bite in Abuja recently, thereby revealing serious gaps in emergency preparedness and antidote availability within public and private hospitals in Nigeria.
The proposal received overwhelming support from senators who called for strict enforcement measures to ensure compliance. Lawmakers said the availability of minimum stocks of antivenom and other critical antidotes should be made a prerequisite for licensing new hospitals as well as for the renewal of licenses for existing health facilities. In his remarks, Senate President Godswill Akpabio described the incident as deeply saddening and extended condolences to the family of the deceased and Nigerians at large.
Snake bite have to move all the ways from the villages to the state capital before they are able to access treatment. If these drugs are made available to our health centers across the length and breadth of the Federation, such needless journeys seeking medical attention at state capitals wouldn't be necessary. And I think government has it as a duty to provide health care to all citizens across board.
Urge the Federal Ministry of Health, in collaboration with the National Agency for Food and Drug Administration and Control, NAFDAC, to ensure procurement, quality assurance, proper storage, and nationwide availability of safe, effective, and affordable antivenoms and critical antidotes for use in public and private hospitals with priority attention to high-risk regions. This is very good. Those in support of prayer 2 say aye. Those against say nay. The ayes have it.
The Senate thereafter observed a minute silence in honor of the late Ifunanya Nwagene.